generative AI is huge. You can't, it's both a cliche and also just the reality that that's going to change things, going to change the whole world, obviously. And so, the challenge for healthcare CIOs and CISOs is how do you take advantage of it in smart ways that you can afford, right?
Yeah.
And so as we are always fighting against the bright, shiny objects that somebody saw someplace and thinks is going to change things, but is either not really going to change things or is not really commercializable or potentially a cyber threat, or just doesn't actually plug into our clinical workflows, right?
Welcome to the Risk Never Sleeps podcast, in which we learn about the people that are on the front lines delivering and protecting patient care. I'm Ed Gaudet, the host of our program, and today I am pleased to be joined by my good friend, JD Whitlock, the CIO at Dayton Children's Hospital. Welcome, JD.
Hey, Ed. Good to see you.
How's that for an intro?
Awesome.
So let's get started. Tell our listeners a little bit more about your organization and your role.
I've been CIO at Dayton Children's for just under 6 years now. Dayton Children's is a small pediatric health system in the Midwest, Dayton, Ohio. And we are the small end of Epic customers, and really the small end of health systems in general. However, that does not mean we are a small organization. And certainly from a cybersecurity perspective, of course, we're expected to, and we have the same threats as much larger health systems, and we need to deal with that appropriately. So that's where some of the challenge comes in sometimes, is how do we act like and be like the larger systems that we have to perform at with a smaller team and a smaller budget. So we are about $650 million for our revenue. Let's see what else is relevant. One hospital, but two large campuses. The second campus is everything but a hospital. And about 24 total care facilities, about 4,200 employees. What else is relevant? One workday. So we're blessed to be on the best EHR and the best ERP, and we can spend a lot of our time optimizing those platforms and chasing after technical debt or people that are not astute platforms.
Small but mighty. And you were an early customer of Censinet, obviously.
Yes.
So you tend to be much more on the path of innovation, given some of your peers in the industry, which is great. So I know you helped us early on really build the platform and help us design the platform, and you continue to do that. Your team has given us some really good insight, even as early as today, or as recent as today. We had a conversation with a few folks from your team. So I really appreciate you and your organization and your team really helping us out and adding a lot of value to the to the industry. So how did you get into healthcare?
I am retired military. I spent 20 years in the military.
Thank you for your service.
Thank you for paying your taxes. Good check everything up. And
you Army or Marine?
Well, I was Navy and then Air Force.
So,
which is part of the story about how I get in healthcare. So I was did Navy ROTC in college. I was a Navy surface warfare officer, which just means on ships. I was driving ships around, did Desert Storm. Actually started Desert Storm by my ship shot the first Tomahawk missile from the Persian Gulf that started Desert Storm in 91.
In 91,
yeah. So I did that for a while, and I had a lot of fun doing that. I did 2 sea tours. My third tour of the Navy was I was a ROTC instructor at UCLA. And most normal people decide what they want to do for grad school and then pick a grad school and go to it. I was at an incredible educational institution, UCLA. But it was time to get a master's degree, and I took a look around and said, well, what should I do for a master's degree? And so my experience was management experience, and healthcare was attractive because I I just like the mission aspect of,
Right.
of healthcare, which sort of fit into the mission aspect of the military, which is part of why I got in the military. And so, the concept that if you do a good job, then you're helping patients, and you're helping doctors and nurses and other caregivers take care of patients. So that's what sort of got me interested in it. I did a Master of Public Health at UCLA, in health policy and management. And then, long story short, I got out of the military to finish that degree. And then, but I was a third of the way into, a military career. And so I actually came back to do healthcare administration, in the Air Force. Long story, not worth telling why I switched from the Navy to the Air Force, but it just worked out that way. And so then second, or the last 2/3 of my military career, 13 years, was a healthcare administrator.
Oh.
In the Air Force, which is obviously a very large, very integrated delivery network, global integrated delivery network. And the guy was privileged to do a large variety of jobs, starting out on the operational side before I got into the IT side.
Mm-hmm.
So I saw what was at the time the largest patient-centered medical home rolled out with the entire Air Force Medical Service before it was cool. And obviously a lot of course, military has been doing value-based care forever before it was cool.
Mm-hmm.
So I learned a lot of great lessons in population health management, for these kind of things that were. Then when I started from the Air Force 2009, moved over to private sector healthcare, was just when value-based care was
right.
CMS was telling us we're all going to do value-based care.
Right.
In the fits and starts that we
nice transition into that.
Right. But I went frequently, and still am sometimes, taking lessons learned from military health. And there's a lot of great things about military health. There's a lot of bad things about military health too. But it was really great experience.
Where were you stationed in the Air Force?
My first duty station in the Air Force was Barksdale Air Force Base in Shreveport, Louisiana.
Ooh,
yep.
Nice.
Then came to Wright-Patterson, where I am now in Dayton, Ohio. Then I did an educational assignment because the military is so good education. They after got into IT, and they said, okay, go actually get smart on IT and go back and get a degree in IT. So I did that. And then actually I finished up in DC, where a lot of people finish up their careers doing basically healthcare informatics program management, let's call it.
So did you retire as a colonel, or?
I'm lieutenant colonel.
Lieutenant colonel. Oh,
yeah.
Right.
Yeah, I made the decision to not go after the command track to get the next promotion, which would have meant going back to being a generalist healthcare administrator after I was deep into the IT and really enjoyed the IT. I knew that I basically wanted to do something akin to what I'm doing now when I got out. And so it actually made sense to stay specialized and then not compete for that next promotion. So I'm very glad that's what I did.
Yeah, no, I love that. I love the common theme of the shared mission too, which is so unique in healthcare and obviously the military, but yet so it's so powerful. And what does that meant? What has that meant to you? The shared mission?
By the way, it just occurred to me something else to mention. We're talking about Air Force. I was looking at your other guest on Risk Never Sleeps. Your number one guest was Drex DeFord.
Yes, that's right.
So you know, Drex is another
I did, yeah.
Service Corps vet. So he and I worked together in DC.
Oh, you worked with Drex. Oh, cool.
And a great guy, obviously.
Yeah.
And there were, there was amongst the people in that massive bureaucracy, there were two kind of people. There were people that always went by all the rules of the bureaucracy and never got anything done.
That wasn't Drex, I'm sure.
That was not Drex. That was not me. You had to know how to creatively, slightly bend the rules to get anything whatsoever done. And in particular, the rules that you could never get anything done were some of the, on the cyber side, was things were done so conservatively could never actually get that next thing onto the network that needed to be deployed, because of mindless bureaucracy, sometimes mindless bureaucracy of the cyber side.
Yeah.
And so one of the reasons I really like the nonprofit healthcare world is you have the same sense of mission, but now that you're out of the bureaucracy of the government, there's still some, you still have to, as we like to say, no margin, no mission. You still have to actually make the dollars make sense, and you can't do really dumb things or you won't be in business anymore. Whereas the government just keeps doing really dumb things and prints more money, right?
That's right. That's right. No politics on the show here.
No politics. Hey, I'm the middle of the road guy. I can abuse both sides.
You can. Did Drex wear the red sneakers back then, or?
I don't recall red sneakers and uniform. No, that would have been that.
That would have been a little too far. A little too.
Plus, it wouldn't have gone well with blue.
Yeah, exactly. Well, I just ran into him recently. He had blue sneakers on. He had the blue variation of those sneakers. So, what as you think about the next couple of years, what are you leaning into? What are your top 3 priorities?
Generative AI is huge. You can't. It's both a cliche and also just the reality that that's going to change things. It's going to change the whole world, obviously. And so, the challenge for healthcare CIOs and CISOs is how do you take advantage of it in smart ways that you can afford, right?
Yeah.
And so, as we are always fighting against the bright shiny objects that somebody saw someplace and thinks is going to change things, but is either not really going to change things or is not really commercializable or potentially a cyber threat, or just doesn't actually plug into our clinical workflows, right? And so there are some things that I think are sort of no-brainers, like the ambient AI clinical documentation, that I would predict, a year from now, if health systems that are going slow on that and not procuring those tools for their providers are going to be losing their providers to other health systems that have. So we're aggressively looking at those tools. And then, back to being blessed to be on Epic's route, because of their existing partnership with Microsoft, they were in a very good position to rapidly take advantage of a lot of the open AI stuff. And so they're rolling out a lot of great tools to, for example, help providers to sort of auto drafts of responses to patient messaging, and just summaries of, hey, here's everything that happened with this patient since you last saw them 6 months ago or a year ago,
right?
Just in a easy to reference, easy to digest form in that 1 minute you have before you walk in the patient. Right? So some of these things, obviously, we're not talking about diagnosing the patient. We're not talking about automatically sending things to the patient. We're just talking about provider efficiency.
Yeah.
Which is the no-brainer thing that the generative AI should be doing.
Absolutely. Yeah. And get better too over time, obviously.
Right.
But the next couple of years will be really interesting to watch in AI in particular.
And on the cyber side, I've tried to keep up on this in the trade press, and there are some great tools that are using generative AI to help with the defending. In addition to the fact, yes, it makes the bad guys a little bit faster, a little smarter to use some of these tools. So we're using abnormal security to catch the inbound fish, and it does pretty nice job at that with some AI under the hood there. Some of the biggest threats right now, we're seeing more of the attacker in the middle, that successfully gets past the multi-factor. That's increasingly prevalent. That's not generative AI. It's just smarter bad guys using all the tools at their disposal.
Mhm.
And so we're also using a managed detection response vendor that's been just within the last year. That's really been helping out a very small team, which cannot be eyeballs on glass 24 hours a day.
Right.
So you need a good vendor like that. So anyways, you never want to brag about your cyber posture. You're guaranteed more problems.
Right.
But I think on that front, the generative AI, it's like much smarter people than I, cyber wise, have sort of said it's not automatically true that's going to make the bad guys. That's an advantage to the bad guys, as long as you're also leveraging it on the defending side, right?
Yeah. How about care delivery? Any shifts in care delivery that you're thinking about over the next couple of years?
We are getting into primary care now, actually for the first time, which is actually odd for most health systems. I'm doing that for a while. Dayton Children's, for reasons it's not worth going into in this podcast, had a clinically integrated network in a common care organization, but not owned primary care practices, with one exception, which was a residency clinic inside the walls for a hospital. So we're going down that route, and that is just changes some of our strategy on the Epic side and what we're doing there. And then we have a low acuity urgent care, which is branded Kids Express, which is sort of the low, which is, your kid's got an ear infection
Yeah.
and you get home from work and your kid's got an ear infection. You want to come in after hours. We continue to open up more of those. So now, obviously, part of where maybe we're going with that question is everybody's talking about telehealth, obviously, and of course, the pandemic, got us past the big hump we needed to go for,
Right.
to make sure that everybody could do that.
Right.
And then, but of course, since the pandemic, then the rates of telehealth have been going down.
Yeah.
And so now we're in a place where most people are, and that, 10 to 20% of ambulatory visits that are appropriate, following appropriate follow-up chronic care, visit that can be done on a video visit, so the family doesn't have to drive an hour and a half to get to us. We want to do that with the video visit, but most of the time, if you want your kid seen by the doctor, you actually prefer to drive in and see the doctor. So,
Yeah. Especially during times that work for you. So you
especially
talked about
when
pandemic, which is a great segue into the next question. Tough couple of years for obviously healthcare, the industry individually, a lot tough on a lot of folks. What are you personally and professionally most proud of?
we were, I think, in a good place from an IT perspective. Everybody was, of course, challenged by lots of people going to work from home and by obviously the telehealth. All go fast on telehealth. We were blessed to be in a place. We had actually less than 6 months previous to the start of the pandemic done the integration work we needed to have a video visit plug into Epic.
Mm-hmm.
So we were ready to go with that. And actually the problem we had, and probably a lot of people had, was we were ready to go on the software side, but we did not have we in our exam rooms had a lot of small PCs mounted over the desk like a lot of people have, not providers just walking around with laptops and with cameras on them, and so we didn't have enough cameras.
Oh.
So of course, you couldn't get cameras because everybody up because the stock of webcams got quickly, and it was a struggle to find webcams. And then as we got them in, we'd have to go in and we'd say, okay, Clinic X, you have, 2 workstations that are going to be telehealth capable. So if you have when you have video visits, go on that one. And then we, last year we opened a new ambulatory, patient tower. And we made sure that all 110 and 120 total exam rooms, every single exam room is completely decked out for telehealth,
Oh, nice.
the little webcams that swivel around and, additional monitor on the wall, all that kind of stuff, set up that's ready for that. Even though if you look at the actual rates of video visits, it's still in the 10 to 20% range, like most places.
Mm-hmm. Cool. So outside of healthcare and IT, what are you most passionate about? What would you be doing if you weren't doing this job?
So I am a baseball fan.
Mm-hmm.
So I've followed the Cincinnati Reds and the single A team for the Reds, the Dayton Dragons. I have a ticket package too, and I can walk to the stadium. My wife and I lived in downtown Dayton after I just graduated from high school. We moved out of the burb with a good school district and moved downtown. And the graphic behind me is the Dayton Arcade, which, as you can tell from looks of it, is one of those, built in the early 1900s, like the original indoor mall.
Yeah.
It's been beautifully restored. And that's actually where my office is. That's literally the view outside of if I turn the other way and look, that's the view outside.
That's beautiful. Yeah.
And so I live a few blocks from here. The ballpark, which is the nicest single A ballpark in baseball, is a few blocks from here. So I can, on many summer evenings, I'll be found at the ballpark. I enjoy motorcycle riding. I don't play golf. If it's a nice day and I got some buddies to go do things with, I'm riding a motorcycle.
Or on the bike. What kind of bike do you have?
Triumph T120 Bonneville.
Nice.
Yeah, it's the like a classic looking, modern engineered motorcycle. Yeah. And then my wife and I are foodies, so we love to travel, and I'm a history buff. So traveling someplace, seeing interesting history, and then having a really nice meal. That would be sort of.
What was your last trip?
Last trip we did Pacific Northwest with both of our daughters. And we did Seattle, Willamette Valley, south of Portland, Cannon Beach, in Oregon. Did some whale watching and ate a lot of great food.
Some great Pinots up in Willamette.
Absolutely. Yeah. Yes.
Very nice. You could go back in time. What would you tell your 20-year-old self?
I would have given my 20-year-old self some advice on women, probably.
Okay.
It all worked out well. I've been happily married to my wife for 27 years.
Oh, that's great.
But when I was
Congratulations.
20, I'm not sure I'd quite figured out how to.
Back in the military at that point?
Back in the day before, at 20, our ROTC student at that
Yeah, you're still in ROTC.
But yeah, back in the day before, dating apps, you had to actually like approach another human being and talk to them. Wasn't very good at that when I was 20.
I don't think any of us are really good at that. I still wonder if I'm any good at it. Okay, so I'd be remiss if I didn't ask you this question. It's the Risk Never Sleeps podcast. JD, what's the riskiest thing you've ever done?
So I mentioned I ride a motorcycle. That's inherently risky. A simple accident that in a car would not be a horrible thing, can be a horrible thing on a motorcycle. I always wear all my safety gear. I don't do anything. I'm not one of those crazy people you see weaving around in cars. Mostly I just want to tool around some country roads, go out with some buddies and eat at a barbecue place out in the country and ride. But I do understand that is an inherently risky activity. I decided it's worth the fun of doing it, but that is inherently risky. The joke of my wife is every time I leave, she goes, "Is your health insurance or is your life insurance paid?" But I mean that recognizing when you do risky things, you recognize what that is. That's one thing. What's the other? Not like physically risky, but I did I do some entrepreneurial, sort of hobby entrepreneurial things on the side. And so I started an internet marketing company on the side. I needed to put some money in that to get that started. That was not big risky because I did not quit my day job and I did not like trade in my whole 401k to get that started.
That's good.
So in the big scheme of things, it wasn't that risky. Right?
Yeah.
I say I enjoy the entrepreneurial community. And I mentioned in my office is here, what you see behind me.
Yeah.
It's the concept. It's like one of these incubator places, and it's entrepreneur center, and they give a lot of support to small businesses. So I enjoy the community here, but a lot of the other people here are doing, no kidding, quit your day job and try to make something go while supporting the family. So I never did.
Yeah.
I never did anything like that. I would probably say I'm relatively risk averse.
All right.
20 years
Nothing wrong with that. Nothing wrong with that. I didn't know if you jumped out of a plane or
no,
swim with the shark.
I never did anything, crazy.
No.
I never did anything. And that was actually part of the deal with my wife. So I got married right about the time I was switching from the Navy to the Air Force. And my wife was actually in the Navy Reserves, and she understood, the military, but at the same time I was getting married, starting a family. And part of the deal was like, I wasn't going to volunteer to do anything dangerous.
Right.
Any more than I had to in the military. I did one deployment in the Air Force to Afghanistan. But I'm a healthcare administrator, so I'm working at the hospital at the big base. I'm not riding around in Humvee, right? And there was an opportunity while I was there to do a different job, riding around the Humvee, going out to so I did not do that because I had promised my wife
not to do.
I was not going to do anything any more risky than I had to do. And the joke was, so I was living in DC at the time. The joke was I was probably at more risk driving on the Beltway. Beltway traffic. There's probably more chance that I was going to run over by a Mack truck on the Beltway than some rocket was going to land on my head in Bagram Air Base. And that's probably literally true. I was probably at more risk on the Beltway. So.
Yeah. So I always ask folks about music or movies so if you're on a desert island, you can only bring 5 records or 5 movies, what would they be?
So I enjoy classical music. So I would go with Beethoven's Ninth, Mozart's Requiem. It's not that I don't enjoy contemporary music, I do, but in terms of like listenability for one of the little things that you can bring. So I'd probably go with those 2. And then, can you do mini series for the movies?
Yeah, you can do.
All right. So I'm going with Ken Burns.
Baseball.
Ken Burns, the baseball one. Of course,
that's great.
Civil War one. I'm a military history buff.
Yeah. Oh, Civil War. Me too. Yeah. Have you been to Gettysburg?
Oh yes. Yeah.
Isn't it great? Great.
It is.
Me too.
And then if you went for just number one favorite all time movie, it's Last of the Mohicans.
Oh,
which of course brilliantly blends military history with just an incredible drama with a great romance.
Yeah.
It just has everything.
Has everything. Yeah. That's good. Awesome. One last question. What advice would you give to new, maybe kids coming out of school that want to get into cyber or into IT and into healthcare? What advice would you give them?
You can add very rewarding career, both in terms of the getting to do interesting things and getting paid good money to do it, whether or not you ever do the management track. Most professions, that is not true, right? But that's a really wonderful thing about IT in general. And of course, it's cyber as sort of a subcategory of IT, right? So if you decide you want to dive deep on some aspects of cybersecurity or data analytics, or you want to be the best network engineer, you can get really good at those things and make good money. Or, if I was talking to a really sharp young IT person now, I'd say, go do cloud architecture. Because you can get a few certifications and make a lot of money doing that, right?
Yeah.
So that's the number one thing is go get some experience, figure out what you like to do, go get those certifications, and you can have a really nice, have a really nice career doing that. And then if you decide you also like, working with people and managing teams, or maybe project management or whatever other, things like that, then great. You can do that too, but you don't have to do that. And then on the healthcare side, I would just say what I said at the beginning, I never regretted my choice of getting into healthcare for the reasons I said. It's just awesome to work in an industry where if you do a good job, that patients get better and doctors and nurses, can do their job and not have to think about the IT. Right.
Right.
Now I'll also say to people, you're not on the pointy end of the spear. You're working in IT. So if you're a glory hound, then IT is not the place for you to.
That's right. Especially not cyber either.
Yeah, exactly.
All right. That's terrific. Thank you, JD. This is Ed Gaudet coming from the Risk Never Sleeps podcast. And remember, if you're on the front lines delivering patient care or protecting patient safety, remember to stay vigilant because risk never sleeps.